Hi, my name is Matthew Snuffer. This is going to be my head to toe assessment. First thing we're going to do, we'll walk in the patient's room. We'll go ahead and draw the curtains for some privacy, do some hand hygiene, introduce myself to my patient. Hi, my name is Matt. I'll be your nurse this evening. Can I see your wristband? Can you tell me your name and birthday?
Sarah Snuffer, 2/25/85.
Okay, Miss Snuffer, what brings you in this evening?
I figured it was time for a checkup.
Okay. Can you tell me a little bit about your past medical history?
I have lupus, restless leg syndrome. I had radioactive iodine done. I developed Bell's palsy with my first pregnancy.
The iodine, was that for your thyroid?
Yes.
Hyper or hypo?
Hyperactive.
Okay. And Bell's palsy?
Yes. During my first pregnancy, I've had 2 C-sections, gallbladder removal surgery, and I think that might be it.
Okay. What about your family history? Hypertension or heart disease, anxiety, depression?
High blood pressure and anxiety and depression.
Okay. No other mental illnesses or anything?
No.
Okay. Drink or do drugs?
No.
Smoke?
Yes.
How much?
Half a pack a day.
Half a pack a day. Are you allergic to any medications?
Sulfa.
Sulfa drugs?
Mm-hmm.
And what do they do to you?
I swell up, my neck swells, my lips swell, I swell.
Do you have any breathing difficulty with that?
Yes.
Any nausea, vomiting?
Yes.
Okay. Tell me about your medications you're taking currently.
No medicines except for a vitamin.
Multivitamin?
Yes.
One a day?
Mm-hmm.
Do you take any other over-the-counter medications?
Tylenol and ibuprofen as needed.
Okay. Okay. How tall are you?
About 5'10".
About 5'10". How much you weigh?
About 190.
Okay. So that's going to put you at 178 centimeters and 86.4 kilograms. BMI of 27, which is slightly overweight, but not bad. Okay. So my patient is going to be a 35-year-old female, white, Caucasian. She appears to be well nourished, healthy. Skin's pink, warm, and dry. Do not see any immediate difficulty breathing or any other immediate life threats at this time. Next, we're going to get us a quick set of vitals. You see your wrist here. Radial pulse is regular, strong, about 2+. Heart rate is about 82, and your respirations are going to be about 18, non-labored. Blood pressure. Relax your arm. On 32/90. quick. 98.7. Okay. Next, we're going to take a look at your head. I'm going to have you just turn here. We'll get us on some gloves. And we're going to take a look at your hair and your scalp. Looking at the color and texture of your hair. Making sure there's no infestations. Do you have any pain on palpation back here?
No.
Okay. Next, I'll take a look at your cranial nerve number 5. I'll have you just bite down for me. Alright. And let go. Bite down again. Alright. And then open your mouth. Alright. And then we'll take a look at cranial nerve number 7. I'll have you smile for me real big. And we know there is some asymmetrical smile there on the right side's a little bit weak. And frown. Kind of the same thing. Puff out your cheeks. Still a little weak on this side. And close your eyes real tight. Now open them. Good deal. Alright, and I'm going to have you just take your glasses off. Palpate your temporal artery. There they are. And they are equal, good and strong, about a 2 plus. While I got your glasses off, I'm going to palpate your sinuses. Any pain or tenderness?
No.
About up here?
No.
No? Okay. And then we'll take and palpate your lymph nodes. We'll start here with the pre-articular. Palpate those. And the post-articular. And the occipital. We'll move down to the submandibular. And the submental. And then the cervical chain, we'll palpate those down. And the subclavicular. Any tenderness or anything?
No.
Okay.
It just tickles.
All right. Next, we're going to look at your carotid arteries. Good and strong. And we'll make sure we're doing these separately. Both feel about equal, also about a 2. Trachea is midline, and I'm going to have you touch your chin to your shoulder, your other shoulder, and look up, look down. Any pain or tenderness with that?
No.
Okay. And then lift your shoulders up. Okay. Now we're going to take a look at your eyes. If I could just have you take your glasses off. And I'm looking for symmetry and how they're, how well they sit in your structure, how they're sitting in your sockets. Everything looks symmetrical. Pupils look good and equal. We'll check your conjunctiva. Nice and pink. Look up. Okay. Sclera looks good. And we'll check your visual acuity. I have already marked this off. If you could, we'll start up here on the smelling chart.
I know it's supposed to be an E. It could be an O.
Okay, cover your right eye.
It just looks like 2 lines now.
Cover your left eye.
It could be an E or an O.
Okay, so your vision is greater than 2200 without your glasses. Put them on. Cover your right eye.
It's definitely an E.
Okay. Next line.
LT.
Next line.
FPH.
Next line.
OLCF.
Next line.
DHJBS.
Next.
Ooh. I think there's a P, a T, a Z, and an O. I don't know what that first letter is.
Okay. And then cover your other eye.
It's bumped up.
Can you see the line above that?
DHJBS.
Can you see this one?
Oh, it's an E. EPTZO.
And then the next one?
Ooh, there's an F, an H, and a J.
Okay. So your vision corrected is about 20/30.
It's a lot better.
Okay. Now we'll do the confrontation test. I'm just going to turn you right here and cover one eye. Can you see this?
No.
Okay. Tell me when you can see it in your field of vision.
Now.
Now?
Mhm.
Okay. Cover the other eye. You see that?
No.
Tell me when it gets in your field of vision.
Now.
Okay. And if I could have you take your glasses off one more time. I'm going to just take a look at light and accommodation. Actually, before I do that, let's dim these lights just a little bit. Now, pick you a spot out behind me. Okay?
Mhm.
And the other one is accommodating as well. Can you lift that same spot? And both of them constrict again. And again, look at that same spot. Or actually, look at my pen. Okay. And next we're going to look at your fields of gaze. So we need to be about 12 to 14 inches. And just keep your eyes on my pen and do not move your head. All right. And we note that there's slight nystagmus on the leftward lateral gaze. Now we're going to take a look at your ear, and we'll examine the outside of the ear. Is there any pain or tenderness out here?
No.
Okay. We'll take a look at the inside here. Pull it up and back. Alright. Canal looks good. I can see the cone of light. The tympanic membrane looks good and intact, good color. Alright. Now we're going to turn you right on around here and do the same thing. We'll take a look at the external part of your ear. No discoloration or deformities and no tenderness, right?
Right.
Okay. And we'll take a look at your ear canal. Looks good. Tympanic membrane intact. See the cone of light. Alright. Now, we're going to do the whisper test. I'm going to include one sign of your ear and I'll repeat something and you repeat it back. Okay.
Okay. Apple, orange.
Okay.
Dog, cat.
Okay. Now we'll take a look at the Ryan and Webster test, which just tests conduction through the air and through bone. Hear that?
Mm-hmm.
Same?
Mm-hmm. Can you hear that? It's louder on this side.
Louder on that side. One more.
Mm-hmm.
Same.
I hear it better over here.
Better over there. Okay. Okay, now we're going to take a look at your nose. First we want to check patency, so if you could just occlude one side and breathe in and out. Occlude the other side, do the same. Feeling okay?
Mm-hmm.
Okay. No congestion or runny nose or anything?
No.
Alright, we'll take a quick look here. And I'm just looking at the septum for any polyps. Actually, let me take a better look here. Looking at the membranes and the turbinates, make sure they're pink and moist. And make sure your septum is midline and not deviated. Next, we'll check cranial nerve number 1. Close your eyes. And tell me what this smell is.
Oh, vanilla.
Okay, so cranial 1 is intact. All right, so now we're going to take a look at your mouth. And of course we put clothes on for this too. Open up. Okay. And we're just going to take a look around. Looking at your cheeks, gums, teeth. Alright. Looks pretty good. Stick your tongue out. Move it side to side. Color looks good. It's good pink. Lift it up. No lesions. Nice. And stick it out again. And go. Okay, not that far out. There we go. Now say There we go. I see your uvula is nice and center line. Tonsils do not appear to be swollen. And one more. Alright, I'm gonna poke back there. Okay. Really?
I'm trying really hard.
Well, it's supposed to elicit a gag.
I know, but you were almost, it was almost there.
Yeah?
Mm-hmm.
Okay. So I just need to go a little bit further.
Mm-hmm.
Okay, well, that tells me that cranial nerve 9, 10, and 12 is intact. And no problem swallowing. Also, number 10.